In recent years, surgical techniques and tools for vision correction have evolved rapidly. Vision problems can be corrected by procedures ranging from laser reshaping of the eye's surface to surgical insertion of artificial lenses to correct eyesight. Presbyopia is a common condition that often results as the lens of your eyes lose flexibility. Reading glasses are the most common correction for presbyopia, but soon you can toss your reading glasses or bifocals thanks to new surgical approaches. An exciting option for correcting presbyopia is expected to be available within the year.
In the past, our hands were very tied, really, in what we could do, what we could offer to the patients. Glasses seems to be still the standard of care, reading glasses. But I think in the next 1 to 2 months, you will hear quite a lot of new things which is going to come on board, which may be available for the Singapore patient. And these include things like an AccuFocus corneal inlay. It's basically a little implant that we slide into the cornea. This inlay is basically like a little donut shape, as you can see down here. It's a very small inlay. This is about 3 to 4 millimeters in diameter. It's probably about 5 to 10 microns thick. And this is implanted in the eye under a corneal flap, very much like a LASIK flap. And this is an eye that you see with the AccuFocus implant in situ, in other words, in the eye. So you can tell that it is in there because I'm telling you it's in there. But if you look at it objectively, it is cosmetically very acceptable because you can't really see it if I don't tell you that there is actually an implant in that eye. And because of the nature of its construction, because of the principles of optics, it does help with near work because it increases the patient's depth of field, you know. And hopefully, if it works well, then we can get rid of, or at least depend a lot less on reading glasses. This trial was actually started back in the Eye Center, Singapore National Eye Center, some years back. And that trial's been completed with good results. So it's actually commercially available now. In terms of the trial itself, Singapore is one of the very few, one of the 2 chosen sites for treatment. And if I'm not wrong, at this point in time, the availability is limited to a few countries, but I think Singapore is one of the first few countries to have it available for use. As in all things medicine, we will learn about this as things go, but it certainly is much, much more exciting than what we used to tell our patients, you know, reading glasses and that's it, too bad, there's nothing else. The other big bonus about this AccuFocus implant is really the fact that it is reversible. So in other words, you put the implant in, if it works, it's great. If patients don't like it for whatever reason, because of some side effects, etc., they can obviously remove it and go back to their pre-surgical state. So that reversibility, it's a big plus.
As we get older, our vision declines. It's a fact of life. You can't escape presbyopia even if you've never had a vision problem before. Presbyopia usually occurs from around age 40, when people experience blurred, near vision when reading, sewing or working at the computer. Even people who are nearsighted will notice that their near vision blurs when they wear their usual eyeglasses or contact lenses to correct distance vision. Eye care is better than eye cure. So do take good care of your eyes. In fact, maintaining eye health improves the quality of life for people throughout their lifespan. Proper eye health care helps slow down the processes associated with aging, such as macular degeneration. It also reduces premature vision loss through strain, disease, and accidents. PresbyLASIK is a new surgical technique to correct presbyopia now undergoing clinical trials. This innovative procedure uses an excimer laser to create a multifocal ablation directly on the eye's clear surface or cornea. This enables vision at multiple distances. The excimer laser is a versatile technology, best known for its use in LASIK procedures.
Again, this is the excimer laser, very well known because of LASIK procedure. And as you know, LASIK is used to correct short-sightedness, astigmatism, and nowadays starting to address presbyopia. Well, this laser also has a lot of corneal functions. They're very useful to treat certain corneal conditions like recurrent erosions, like corneal scars. While it is true that this laser has been around for a long time, as with technology, the lasers today are much faster, much safer for patients. Results are a lot better. For instance, in this particular laser that you see right here that we're about to treat this patient for short-sightedness, all these lasers come with a tracker device. In other words, if you're able to see the little screen, a little eye on the screen, you would find that when the laser locks on and the laser treats, even if the patient who moves or the eye moves, the laser is capable of tracking, kind of like a heat-seeking missile, you know, that it always strikes the correct point at any one point in time. So all these things really generate a higher degree of accuracy and safety for many of these patients. Okay, good. See you tomorrow.
If you are considering LASIK eye surgery, your first step is to choose a good surgeon who can evaluate whether the option is right for you. Your surgeon will examine your eyes to determine their health, what kind of vision correction you need, and how much corneal tissue should be removed. The doctor will also ask about any health conditions that may disqualify you for LASIK surgery.